In this lesson, we'll review basic tasks for contracting with private health insurance companies. These duties are usually assigned to your department's contracting specialist. After the lesson, you'll be able to list key information you'll need when first contacting an insurer and explain to a private insurance company the value of contracting with your clinic. There are many insurance companies in California, and not all will have a presence in your jurisdiction. As public agencies, we do not endorse any specific insurer. However, we've highlighted contact information for two large companies that may be useful. As of 2013, Anthem Blue Cross is the largest private health insurer in California. For this reason, establishing a contract with them is usually a priority. Contact their network relations by email to get started. Cigna Healthcare has made an effort to recognize public health departments as a resource for their subscribers. Consequently, they offer special immunizations-only contracts for use in several states. This is in process for California as of 2013, and Donna Dohan is the designated Cigna representative handling California accounts. When you call, give your department's legal name and tax ID number. To get a refresher on this information, please refer to the downloadable job aid on private insurance contracting Getting Started. Now we'll review some important steps to prepare you for calling an insurer's contracting department in order to set up a new contract. Before calling an insurance company, you'll want to have a system in place to keep track of who you talk to. A good way to do this is to keep a log of the people you speak with at each of the contracting departments. The downloadable job aid for the sample insurance contracting log sheet will give you this sample log, which you can adapt for your own needs. It lists the contact date, your name, the names of who you talk to, and their contact information. Insurance representatives are in a high turnover industry, so keeping track of who you spoke to earlier can help avoid having to start over with a new rep later on. As you work through the contracting process, you'll need to keep track of many documents. One way to organize your information is to use a multi-tab folder like the one pictured here. For a detailed description of how to set this up, you can refer back later to the downloadable job aid on how to put together your insurance folder. When you call an insurance company contracting representative, be sure you're ready to explain who you are and how your department can be an asset to their network. Unlike Medi-Cal or other public payers, private insurers don't have to contract with you. They may need to understand or even be convinced that contracting with a public health department is good for their business. To help, we'll offer some talking points. You can refer to these on the downloadable job aid on talking to an insurance contracting representative when you're preparing to make your first contracting call. Be sure to ask for and document the insurance representative's contact information on your insurance contracting log sheet. The insurance representative may ask you for supporting documents. These can vary somewhat from one company to another, but certain materials are common to all. A sample list is available on the Job Aid Private Insurance Contracting Documents checklist. Note any specific contract-related documents they request when you're on the phone. You can add these to your checklist as needed and send the documents later. A prompt response on your part will help maintain momentum.
Hi, Timmy Granados, Billing Coordinator here to give you some talking points on how to make your contracting arguments more persuasive. You can think about promoting your health department as a convenience for their insurance subscribers. I recommend telling the insurance rep about their subscribers that are already coming to your department's clinic, but this is best only if you're prepared to give substantial numbers. Another way to frame your argument is to talk about the reasons why their subscribers are coming to you. For example, there may be few private providers available to serve them in your community. You can explain that their members rely on public health as a safety net when their regular doctors are not available or don't stock required vaccines. You can even talk about your highly trained staff and their orientation to educate patients to prevent disease and keep them healthy. And don't shy away from explaining how public health clinics are crucial to your community's health and worth being reimbursed. If the insurance rep is receptive, go ahead and ask for an application.
After speaking to a contracting representative, follow up the conversation with a formal letter of intent. This document should be a business letter on department letterhead. You can download the job aid for a sample letter of intent to adapt for your department. State your intention to become a network provider and briefly list the reasons why you would be an asset to their network. List your clinic locations and any specialized services you provide, such as specific lab tests or vaccines. Have the document reviewed and signed by your department head. Send the letter and any supporting documents requested by the insurance rep to the address they gave you. After all your submissions, the insurer's credentialing department will review all the materials you submitted. A credentialing representative may contact you for clarification or additional information. When completed, you'll receive an email or letter stating your status is either approved or rejected. Now we'll walk through what to do once your contract has been approved. After the lesson, you can refer back to these points from the downloadable job aid on insurance contract implementation. Once you're approved, you'll receive a copy of the contract either by mail or email. The insurer will also send you individual PIN numbers for the clinic, lab, and each provider. If your clinic uses an electronic medical record system, be sure to update it with the new PIN number and the payer ID number. You'll need to make sure that clinicians and staff handling registration and billing know about the new contract so everyone is clear about collecting fees from patients and the contracting insurer. You'll also need to stay on top of changes to the insurer's rules, reimbursement, or benefits over time. You can do this by checking the insurer's website on a regular basis. Your patients will appreciate it when the information you give them about billing is accurate and up to date. Now, please follow the instructions to take the quiz for this lesson. It will look familiar. It's the same one you took before viewing the lesson. This time you'll be able to see correct answers as you respond to demonstrate what you've learned. After you've completed the quiz, you may continue at your own pace to view subsequent lessons at your convenience. The lessons are ordered, so you'll build your knowledge of each part of the billing process that relates to your role. When you finish all the lessons, you'll be able to print out a certificate of completion to reward your efforts. Thanks for your attention. Please continue on to the quiz.